Hi, welcome back to my channel. I'm Dr. Hampton, a board certified family and obesity medicine doctor. And today I want to talk a little bit about the mind and how we think. And in order to have that conversation, I have Violet of the Road to Health YouTube channel. I'll make sure to have a link to her channel. We're going to collaborate on this video, so you can just click on that link. And I really am happy that you're here today. So today, really thought about lately is this ideal of our mind works and why it's so important to have things appear. Now, the good thing about low carb, keto, and carnivore, and Dr. Georgia Eat would say this, it's a phenomenal diet to help us stabilize our brain. And I think it's one of the best things you can do to think and be present in the world, whether you're dealing with a bipolar diagnosis or just anxious sometimes. And I know that since I've been low carb, keto, and now carnivore, and particularly carnivore, my mental clarity is off the chain. My ability to focus is off the chain. I'm not going back to the life where that didn't exist. And as a doctor, a husband, a dad, someone that's trying to be in front of you with these videos and podcasts, I need to have my brain, guys, and I need it so bad. But what I like about Violet is that she talks about the brain often. She's thinking in that lane. And I wanted to ask her a simple question. Why traditional talk therapy may not be enough anymore? What else do we need to be thinking about to make sure we're thinking clearly, that we're present and able to live our life purpose? So Violet, thank you for coming to the channel. And why don't you frame that conversation in a way that makes sense for my audience?
First of all, thank you for having me. One of the things that I've noticed is that when people are trying to solve things in their lives, they're going to come talk to somebody like me. And while we're going through what's happening, often the advice that I'm going to give them, even if they action on it, so they do exactly the things that we talk about, if their health isn't going well, all of these things that we're talking about doing and trying to change will be forgotten because health-wise, they're not in a good space. And to your point of Dr. Eid, one of the things that she taught me was that the way that your body, whatever is good for your body, is also good for your brain. And so when we're feeding our body things that isn't helping it to build itself properly, that means that we're feeding our body things that it can't build our brain with. And one thing that I've noticed is that if people eat better, mental clarity is one of the first things they talk about. Now, I went keto in 2018. My entire work life is working with people, helping them to change things in their lives, helping them to improve their lives. And in 2018, after about 3 months, I found myself incredibly surprised at how much better I was thinking. First of all, that's good for the people I work with. But second of all, that's good for me. I was able to learn more. And even if you look at the fact that now I'm learning things about the body's health, which is not my original field of study, having a brain that works properly is based on feeding your body properly. And it's just you can't separate the two things. And then if my brain is working better because I'm feeding my body properly, it can build it better, the connections are better, everything is firing properly, of course my mental health is going to improve. And I feel like this is something, I'm not sure why it's not spoken about more, but also I feel like every person who's changed their diet, I don't think I've met one who hasn't said mood stability was something that they also got. Now, I already had mood stability, but I've spoken to many people who've said that their mood swings went away and that they were less aggressive, less moody, less like so many levels, Tony, that we have evidence that taking better care of your body by eating better actually improves both physical and mental health.
Nice. And what's funny, you said you already had a pretty stable mood, but you don't really know what you don't know. For me, I thought I had I'm just as laid back as they get, calm, but it's even better. I feel like it's optimized. So when faced with challenges, it could be, we have cold blues in my clinic. And when those moments occur and you're supposed to lead the team, I'm just calm. And so for those who are checking us out, it's not just about fixing something. It's about not even realize you had something to fix. And I actually got better in areas that I thought I was already doing good at. So it's really nice to know that that's true. I'll ask you a follow-up. You spoke about diet. When it comes to other things, like I have my nest, my nutrition, exercise, less stress, more sleep, etc. So when you're talking to people and you're advising them, and in my case, when I'm trying to problem solve why they still struggle and they can't seem to do the diet, right? Or I would say dietary, approach. What other areas do you find really stand out that you really want to speak to that allow us to understand it's not just about talk therapy?
So I feel like there's a lot of push for exercise. Although you get endorphins from exercise, I don't feel that they sustain as much as the diet change. However, sleep, I found, so diet and sleep, when we get those two going really well, I feel like those are the things that I see make the biggest improvements in people's lives. And then when they kick on the exercise after, now we're really rolling. And part of the reason I want to point out, I want to back up a little bit with the exercise, trying to put that first. When we're exercising and we get those endorphins going, and it's kind of if you have anxiety, I feel like people who are anxious can end up kind of not doing as well as we would think the exercise would help them do. For depression, yes, I've seen some benefit, but neither of them benefit as much as diet and appropriate amount of sleep. So when you get your diet right, you're not oversleeping when you're depressed. It's like somehow that regulates. And it makes sense, right? Because you're fueled your body properly. You want to get up and do stuff. But I also find that anxious people, like that ability to fall asleep comes back. So there's so many things that I've just noticed in the conversations I'm having with people that help me to see that the extras, and I call these extras because going out to exercising or the steam rooms and this red lights and all these extra things, yes, they are good once you have your foundation down. But if you don't have the foundation, it's a band-aid and it's not long lasting. You feel good while you're doing it. And that's still worthwhile because you feel good while you're doing it. But for long-term, better mental health, the food and the sleep are so, so, so important.
Wow. Well, I'm glad you brought up sleep. Literally this past week, had a couple of days where we were doing some work that required me to get less sleep with my health system. I had to prepare some things we're going to present to the Kennedy administration about metabolic health, et cetera. And he seems to be aligned with that. So I didn't get as much sleep, and it affected me in ways that blew my mind. So I tell people, when you're trying to know you're getting enough sleep, the most obvious thing is that you can wake up without needing an alarm. That's kind of a logical thing most people don't know. You can get through your day without needing caffeine. There's nothing wrong with coffee, but if you can get through the day without it, that's a good sign. But the thing that will really surprise you, and it affected me this past week, is if I'm not getting enough sleep, it affects my mood, right? So my mood's going to be off, even if I'm not showing it outwardly, but I get irritated easy. Somebody shows up 45 minutes late for an appointment. It irritates me when maybe it wouldn't have otherwise. For people who struggle with food addiction, they may struggle with cravings for sugar and carbs when they don't get enough sleep. So I just think that there are so many things. And sometimes the lack of sleep or the amount you get is, I'm not talking about like, it could be like an hour difference or 30 minutes. Your body is such a circadian system that you can just be off by just a little bit and you can feel the negative impact. So I think it's important as people think about what Violet has said, your diet and sleep. I think you may be right. If I could change my nest around and rearrange it so it'll make sense, I'd probably put the N and then the S first, but it is what it is. So, but I do appreciate you bringing this to the conversation. Any final thoughts before we wrap up this video?
Well, I would also add to that when we pay attention to our children, a lot of these things become apparent, right? If our kids didn't eat, their mood is all over the place. If our kids didn't sleep, their mood is all over the place. I feel like we don't give they never stop playing, so we can't test the exercise theory, but we don't give enough attention to the fact that we see it clearly in our children, and fixing it in ourselves is then obviously going to be important, because I think we try to look at kids as so different from us, but they're not. They're little teeny versions of the same system, right? And they haven't had the huge influx yet of carbohydrates that we've had. So looking at how their little bodies function correctly gives us a lot of clues about where we've messed up and like how we can fix it. And I think it's all about fixing it. The number one thing that I want to point out is that if you look to best practices, you will do better. And best practice is not about putting a band-aid on anything. Best practice is about knowing what the actual ideal goal is and aiming at that every day when you wake up. If you do that repeatedly, you will have success.
That's a great way to wrap up the video because we're all walking towards something. We're all trying to achieve something in life. And why not spend a little time every day? Just a little bit. It doesn't even have to be like an hour. Just give me 15 minutes. And if at the end of the day, you can say, I did something toward my goal is to be in a happy relationship, that I do something towards that. My goal is to advance in my company. Did I do something towards that? My goal is to eat better. Did I do something towards that? So if you do those little things, you don't have to do extraordinary things in one day, but you have to do the little things. So thank you, Violet, for sharing your perspective. I do believe that this idea that we have to do more than just talk to the behavioral health professional is not enough for everybody. And for most of us, we need to think about nutrition, sleep, and recovering from trauma and making sure we think a certain way as the key. So I encourage each and every one of you, if you want to hear more from Violet, check out the Road to Health channel. I think you'll get a lot out of it. And she provides insights and a different perspective that I think that's adding a ton of value to the low carb, keto, and carnivore community. So thanks again, Violet. And looking forward to doing this again in the future. So thank you so much.
Thank you.